debates before we get to rates. I want to keep pushing this notion of technology transformation in healthcare, how we actually recoup some of that.
Let me say here, I want to work with you on it. I think this is extraordinarily important. It hasn't gotten enough attention.
Thank you, Mr. Chairman.
Senator Helmy's next.
Thank you, Chairman. As someone who spent nearly a decade working in healthcare and helping run the most diverse state in the nation, I'm going to focus on access. And I applaud the work of our chairman in this committee. The resources that provided by legislation that came out of this committee has increased access and allowed for healthier communities that become more innovative and economically viable communities. And I'll spend some time on that as well. But it also allowed states like New Jersey, where the Murphy administration was able to take the resources provided by the chairman and the members of this committee, expand on them to provide more access and more care, which has led to increases in insured populations and in healthier communities. Dr. Conte and Dr. Lambrou, if I may, you both have extensive leadership experience, and I'd ask you, with your studies in advocacy and healthcare access across diverse populations, as mentioned, we're the most diverse state in the union. Give me the impact, please, of the IRA financial resources on healthcare access for low-income communities, communities of color, and migrant communities. Specifically, if I may, Dr. Conte, as I think policymakers spend a lot of time talking, there's been some conversation on committee about the costs input, but not the economic viability that comes with long-term healthcare access and affordability, both on a physical well-being of a community and the economic well-being of a community. Thank you.
Yeah, thank you so much for your question. With lower prices of prescription drugs, not only do seniors in general benefit, but seniors of color benefit. Communities that are low income or low middle income directly benefit from IRA provisions. In addition, we expect when people are not choosing between paying for their medicine and paying for groceries or rent, that adherence to therapies that are effective and that are cost-effective will go up, and therefore better health, better control of diabetes, better control and treatment for cancer will follow.
And I would add that we do know that lacking health coverage is one of the major causes of health disparities by race and ethnicity. So in the marketplace, what we have seen is a tremendous growth in our Hispanic, Latino, Native American, across the board, populations that historically don't have employer-based coverage, have been left out of the system. The tax credits in this policy, the increased choices that have resulted, have allowed those individuals and communities to come in, get covered, and we do know that having coverage increases preventive services use, helps people manage chronic illness better. It prevents all-cause mortality, and going back to those community effects, it means that that family may be able to afford childcare. They'll be more food secure. They may be able to afford rent. So we know that there's significant impact of being insured. There's 2 decades worth of research on this.
Thank you. Dr. Lambrou, if I can stay with you, as I mentioned, sort of the economics of this, access is also a critical element to any innovation economy and a growth of economies, specifically when you talk about the startup of small businesses. If you could you speak to the impact of these subsidies on innovation and entrepreneurship, maybe with some specifics on expected growth if we're able to make healthcare more accessible and more affordable? Thank you.
Absolutely. I think one of the untold stories of the Affordable Care Act is exactly that. It has filled in that gap for people starting businesses, people striking out on their own. And we know from older data that in 2021, 2.6 million, or 1 out of 5 marketplace enrollees, were either a business owner, small business owner, or an entrepreneur. That must have grown because we also know that the uninsured rate for those two groups of people went from 27%, 25% in 2013 to a record low of 16% in 2022. Again, this is during pandemic. Those are extraordinary facts. Since the Affordable Care Act was passed in 2014, 50 million people have come into the marketplace to get coverage, usually, again, between jobs, starting new businesses. And I think we have a sense, especially in a state like mine, that it's really made a difference. We merged our individual and small group market in Maine. We're providing reinsurance through the Affordable Care Act for our small businesses as well. So If this policy is not extended, it will have significant harm for those small businesses and entrepreneurs.
Thank you, Dr. Lambrew. I'd just like to close, Mr. Chairman, by thanking all the witnesses for participating in this dialogue, and specifically you, Ms. Aiken, for your very personal story. Thank you. Thank you, Chairman.
I thank my colleague for his important questions. So senators are all coming in, so we're going to stay with the order of appearance. And Senator Bennett, you are next, if you can
Thank you,
catch your
Mr.
breath
Chairman.
and go.
Thank you for the panel for being here, and I appreciate our new member on the committee. I guess it's for Dr. Conti. We spend $4.5 trillion, more than 17% of our GDP on healthcare, which is twice as much as other industrialized nations spend on average, and yet Americans die earlier than our